Well, good morning, everybody, and thank you for joining us. I'm super impressed. Everyone has been so punctual this morning, which makes our life really that much happier this morning. My name is Mark Jones, and I am your host for this morning's webinar. We have a great conversation ahead of us this morning. So welcome to this ehealthspace.org webinar. It is proudly sponsored by Kronos. We're speaking about Mater Health Services' journey, and we are in for a great conversation about how Mater has transformed its payroll and rostering systems. And in fact, it's an amazing story because we're going to hear about how Mater has literally come back from the brink of a potential system failure. And today, if we look at Mater's systems, and we'll be hearing about that in a moment, Mater boasts some very impressive productivity levels and all sorts of business gains that I know you will find very impressive. So we have an opportunity to hear how Mater has literally transformed the way it operates on a daily basis. Our special guest today is Caroline Hudson. She's Mater's Executive Director of People and Learning. Thanks for joining us, Caroline.
Thank you, Mark, and hello, everybody.
Indeed. And before I hand over to her in just a moment, I'll say this, that Caroline has a real passion for her work. I've been really interested to hear her story, and I know that she is looking forward to sharing her experiences and her insights with you. Now, just before we get going and I hand over to Caroline, as I said, on your webinar panel you'll see there is a comment box, and you should be able to ask questions in there. There's a little tab that you can pull down and you can ask some questions. Everybody is in listen-only mode for this conversation, so I ask you to write your questions as we're going along. I will have a Q&A session at the end, and I really want to make sure we get through as many of the questions as we possibly can in that time. We have set aside 30 minutes for the presentation and then an advertised 45-minute session in total, and so 15 minutes we were thinking was a good time for Q&A. But I do know from experience that we can run over if there's lots of interest. So if that's the case, just to telegraph now, we're quite happy to run up until 12:30 and make a full hour of it if there's lots of interest and lots of questions. Caroline, I know, has lots and lots and lots of things that she'd like to say, so we're happy to be generous with our time as much as we possibly can, aren't we, Caroline?
Indeed, thank you.
All right, well, with all of that said, I've been, as I said, it's great to see people continuing to join us here this morning. The attendee list is growing wonderfully as we continue. So without any further ado, Caroline Hudson, Executive Director, People and Learning at the Mater. Thank you for joining us, and I'll hand over to you. You have control.
Thank you, Mark. Okay, so let's start this journey that Mark has just spent a few moments explaining to you. 7 years ago when I arrived at the Mater Health Services, this gorgeous old building that you can see on the screen is the original Mater Private Hospital, which was built over 100 years ago by the Sisters of Mercy on Mater Hill. We now have 7 hospitals with more than 7,500 staff providing public and private services for adults, children and women. And we've got an 8th hospital actually which we're building and will be commissioned in about 2015, so that's pretty exciting for us. But the Mater was a bit different when I arrived 7 years ago, although I don't think it was that different to most health services. My view is that health services had actually lost pace with other industries, and they were at the time in other industries investing huge sums in their talent and workforce management tools during what was referred to as the war for talent in the lead up to the GFC, but that wasn't actually the case in my experience in the health industry. So the Mater wasn't an orphan in terms of its investment, and we had nearly 800 nursing vacancies and no strategy for addressing that or lots of the other challenges that we faced at the time. Unfortunately, these challenges were compounded in my team by the really genuine but misplaced belief that customising anything that a Mater manager or a client wanted was actually good customer service. And sadly, you can imagine that this resulted in all sorts of inconsistency, lack of standards, and it was incredibly difficult to manage, and it was spiralling out of control. So the more the team tried to please everyone by giving in to their various demands, the worse the situation got, with absolutely no consistency of process and lots of system workarounds. In addition, our volumes were actually increasing exponentially. We were growing fast, and the workforce had nearly doubled in size over a 3-year period. And to be honest, what I found was systems that were already broken and stretched beyond what they could cope with. So it was kind of scary to arrive to a situation like that, and I must admit that in the first sort of 6 months or so I did wonder if I'd done the right thing coming into the health industry, but as you can see I'm still here, so it's a good story. As many of you would know, that health workforces have some of the most complex arrangements covered by dozens of awards, enterprise agreements, right of private practice arrangements and contractual variations. And as a provider of public and private health services, our systems needed to cope with more than 300 time-based allowances. By way of comparison, Queensland Health has just 170 time-based allowances, but because we provide public and private services, we need to replicate to some extent, with slight variations always, just to make it interesting, those many, many allowances. And we're also one of the few workforces, as many of you would know from the health industry, where hundreds and hundreds of our staff in each workplace work in multiple roles, covered by different industrial arrangements and conditions, and that's a particularly difficult scenario to manage in a rostering and payroll system. So the slide that's coming up on your screen now is actually one that I shared with my executive colleagues in 2006. I actually took this to an executive meeting. We were a bit desperate, and I needed to demonstrate the challenges and the risks that we were facing at the time. So as you can see on the left-hand side of the screen, Roster 2000 was the legacy system that we had in place. It says it's automated. I'm not sure that it was necessarily automated in any sophisticated fashion, but yes, we did have an automated rostering system which fed into Supercard, which was an award interpreter, and that was both not supported, but also we could see evidence of corrupting. So mid-2006 it was in really bad shape, and what that meant, that was that every Monday morning at the close of the pay period, hundreds of managers and people managing rosters needed to make changes to to the roster that had occurred over the previous fortnight, and so the system would fail on a Monday morning for hours, and time was against us, so you'd find frustrated managers just completing roster amendment forms, and this would we would end up with more than 500 of those every week. On the right-hand side of the screen, you can see that we were doing manual timesheets for the hospitals that didn't have a rostering system, and so we had about 1,600 of those to calculate a week as well. And I shouldn't laugh, but at the time we actually used to taxi in many of our timesheets from the hospitals, from our hospital on the coast. So you'd get this sort of, taxi come racing in on a Monday morning and dump off boxes of timesheets that we needed to process. Just putting enormous pressure on us and on the system and on the business, and it was a pretty bad situation for employees, because this slide that I've got up here at the moment is another one that I shared with the executive, and what it does is it shows you the timeline that we were working to. So you can see that the pay closed on a Monday at 10 a.m. and in order to get a pay run through on a Wednesday, we needed to have everything in by Tuesday midday. So we found ourselves up against an enormous challenge, processing hundreds of amendments, systems crashing on Mondays, and many, many manual timesheets that needed to be processed as well. And the team were under the pump every minute of the week. What we would find would be on payday on a Thursday, we would get inundated by phone calls. So that would go straight into the team, 600 inquiries, all about the pay being wrong, and of course half of the reasons that the pay was wrong was because managers hadn't been able to make the updates in the system, or we hadn't managed to get to a roster amendment sheet, and it just was, as you can imagine, compounding pay period after pay period after pay period. And it's kind of interesting when we think back to what that looked like in those days, because that's exactly what Queensland Health found themselves having to face too, with the tightness of the pay run and the fact that there's lots of amendments to be made. And I can say that because Lawrence Springboard was heard on radio not long after he got into office saying that was exactly the situation that had to change if they were to have any hope of addressing their major process failures. So the vast majority of calls that we got were from desperate employees, and they had to be managed, and that of course just took payroll staff away from the work that they needed to do to process for the next pay period. And so we needed to do something drastic to change this situation. And we needed to do it before we put any payroll systems in place, payroll or rostering systems, which kind of is counterintuitive to a lot of people, because it's obviously part of this problem was caused by the IT systems. But in our way of thinking, while we knew that it was important that the IT was changed, we also knew that it was important that other things were changed too. So we all know that we put systems in place to get a better outcome than the one that we've come from. And yet somehow it's common to find ourselves configuring a system that replicates the past, albeit in an automated fashion. And looking at where we were and having a really clear view of where I wanted to go and what I needed the future to look like, I took a strong view that we needed to rebuild all our processes, including all of those manual and people-driven processes that feed the IT systems. And that meant redesigning all that we do for the entire employee journey. And to do that, our processes must be heavily influenced by the people who do the work. That is my team. And so I think that's a real point of differentiation for us. I employ a very small team of Lean and Six Sigma practicing black belts, and you can't see their faces, just like the dentist in the ad, because they believe that they must become invisible by building capacity in others, so you only get to see their black belts. But I'd like to share with you what we did to our processes that was also different. So here you have what we call the Fruit Loop slide, which is about the way which we actually approach our service delivery. So we talk about people joining the master team, playing in the master team, and leaving the master team. And as you can see on the left-hand side are the process owners, the people who own those processes of joining, playing, and leaving. And across the top are the more traditional activity owners, so the line manager out in the business, the recruitment manager, the human resource information management system owner, the rostering owner, the payroll activity owner. And the people on the left are responsible for the process design, control, and change that occurs to any process. So it's not the activity owner, which is the traditional model, it's the process owner. And the process owner probably doesn't have a team as such, but they will be responsible for any changes to that process. So you don't get random siloed ad hoc changes occurring by those across the top. The team leaders across the top, or the activity leaders, manage and supervise the teams who actually carry out the work. And the work that they do is all about transforming processes and delivering services. So when we transform anything, every single element of every process is mapped and costed, and all the time we're looking at ways to reduce waste and eliminate duplication. And this is just some examples of some of the maps and forms and so forth that we used as part of the payroll and rostering implementation change processes. And this has been really successful for us and has increased our productivity as a team by more than 400%, along with improving the outcomes and the service experience that the Marta employees and managers receive. So the world no longer looks like it did on the slides that I showed you earlier. It also means that because everything is mapped and documented and well recorded, that if future changes need to be made, it's much, much easier to do that and to make it sustainable across the teams. For example, in the past, calls would come straight through into HR when anyone needed assistance. So that was the 600-odd calls into payroll I talked about earlier, or any other phone calls that were coming in. And obviously, you know, people would ring in hoping that someone would answer the phone, and if they didn't, it would go to voicemail. Then they'd hope somebody would get back to them, or that somebody who could help them would answer. All a bit random and hard to manage, with no visibility of the types of calls or any escalation of issues. The ability for us to plan for anything that might be arising. So by funneling calls to an HR help desk, much like the IT help desk, every call is answered, and we're able to target a wait time for people phoning in of less than 80 seconds. The HR help desk have all the information that they need at their fingertips and rarely have to refer a call on to someone else for assistance. They take about, as you can see on the far right hand side, about 50,000 calls a year, with more than 85% of our calls waiting less than 80 seconds. We think this is really important because clinicians and staff in the business are busy, and we believe it's really important that they're not away from their patient care areas or the bedside or whatever the work is that they do that's important for any longer than is absolutely necessary. Similarly, we were actually able to achieve good results with our issuing of contract of employment contracts as well by improving the processes and systems and the IT that we use. We can actually issue contracts now within 48 hours instead of 6 weeks that it could take. In fact, it was almost up to 12 weeks in some cases to get a contract when I first arrived at the matter, and it was pretty hit and miss in terms of its quality. And now the system, with its single source of truth, drives the issuing of contracts and allows us to keep our system up to date so that it's current and can drive all sorts of other interfaces within the business. The implementation of our new and I would say more sophisticated rostering and HR payroll systems has provided us with so many benefits that go way beyond their immediate functionality. As you can see, we've taken it a long way beyond just the piece of IT. And allowed it to drive and improve so many of our other processes, or support and our other processes. And my view is that they've provided us with a platform from which we can continue to improve the quality and timeliness of the services in our business while providing an accurate single source of the truth that really is incredibly powerful and so much more powerful than perhaps we realise when we're sitting on multiple systems. These are just some internal to HR business benefits. So we've gotten from ratios of 1 person, 1 payroll officer to 255 employees, up to 1 to 1,500 now. I could quote some scary statistics from other health organisations that are suffering from their payroll circumstances at the moment, but I won't. But suffice to say they're worse than 1 to 255. And look, it's a pretty bad place when you're living in a world where you have to have so many payroll staff. For us, we're down to very small numbers in the payroll team now. And what we've been able to do is redirect the savings in those resources where we can really add much more value in the team, and the quality then of the service offering is so much better. We've also reduced the number of manual pays that we do, so we've automated so much more, as you can see, because every manual transaction and every manual pay run is a risk, and so we obviously need to minimise those risks for accuracy's sake and for error's sake. And the number of roster amendments, as you can see, has gone from more than 2,000 a month to less than 600, which we'd actually like to get down further. And the number of payroll inquiries has gone from 600 on a payday to 40, which is completely manageable, and obviously means that the experience of the employee is so much better, because that means there's, what is it, 560 people who now don't feel upset because their pay's not right, or who have concerns that their pay's not right, which has to be a good thing. The business itself, there's some quotes here from various people in the business who talk about what their experience has been in terms of the rostering and payroll implementations and what they can now see that they couldn't see previously. So you can see the General Director of Surgery in the middle of the screen there saying he had a fatigue problem that was probably invisible. I have to say I didn't even know that that was his view, that he had that problem, but now we can all work on it and actually do something about changing that. And the Director of Anaesthetics was saying he wasn't compliant with employees' EAs, and we know that that was the case because we actually had to go to the Industrial Commission to change some of our arrangements, because we'd had these practices that actually were wrong for so many years that once we had visibility of them, we were able to address those practices. And on the left-hand side, you can see there's some generic benefits that have been described as well. So There are definitely some lessons that we've learned along the way, and things that we would do differently in future. And because we went with rostering first and rolled that out across business units in a sort of a cascaded way, and then went for a big bang approach with the payroll implementation, we learnt lessons from the implementation of Kronos rostering system, which we were then able to use in the big bang approach for the implementation of Orion. We're now going to put in some further enhancements in our systems, which I can talk about later if you're interested. And I think there's lessons there that we'll be able to apply to our future implementations. But we're always happy to share them and let people know what they too can avoid. This last slide is our new Mothers Hospital. So for me that represents the new world. So I showed you the beautiful old building that we had on the hill, which I saw when I first arrived, but this one is all about the future. And so we've got lots and lots of plans to enhance our tools, and there's lots of room always to keep improving the way that we manage our workforce. And as labour shortages do start to increase again in the future, and they will, maybe not right now, but they certainly will in the next few years, we need to get really slick in-house at managing that workforce, and there's so much that we can do with the tools that we have available to us, and so that's what we will be doing. So Mark, I'm happy to answer any questions that anybody may have. There's lots more to share, but that's probably a reasonable summary of the journey so far.
It's a fantastic journey. Thank you so much, Caroline. There have actually been a couple of questions, and we'll get to those, but let me just kick things off. From my point of view, really dramatic story, interesting, that sort of, my goodness me moment you had when you first joined up. You thought, what have I got myself into? What was the, just how close were you to some sort of very serious failure when it came to rostering or payroll? When did that sort of dawn on you that, my goodness me, what have I got going on?
It's probably not the first year or so that I was in at the Mater. It was probably after about 18 months that the system was there was corruption going on in the award interpreter. So that combined with the performance issues that we were seeing on a Monday, where the system would crash regularly and have to be rebooted, it was just becoming more and more regular, and the pressure on us and the system, and then the corrupting really started to worry me. From memory, I think that was leave data that was being corrupted. I'd have to try and remember. But that started to say, this is getting pretty scary, in health, the payroll is a huge proportion obviously of your total expense, and you start corrupting that sort of data and you get yourself into a real mess. So yeah, I was pretty concerned, and that was one of the reasons we made the decision to go with the rostering replacement first. It posed for us the greatest risk with the award interpreter corrupting and the performance of the system being so poor, and we felt there were a couple of reasons. There was that, and also we were able to roll it out across individual hospitals as opposed to having to do a big bang implementation, which obviously also had huge risk. So that was they were the main reasons for going with the rostering system first. But yeah, it got pretty scary.
Yeah, I can imagine there was probably some, heart-in-mouth type analogies here. Self pun there. Now, there's one of the questions here that I think is a great step beyond that question is, did you undertake a significant change management process?
I would separate that into two parts: change management in terms of the business, or change management out to the client, if you like, in the hospitals, or and then separately change management within the HR team. Quite different for rostering and payroll. So rostering is an outwardly facing tool, if you like. It's has huge interface with the managers out in the business. They rely on it, use it, become quite expert at using its functionality, and it's something that they rely on every week. The payroll system, on the other hand, is a little bit more light touch, other than driving some changes to employee conditions, which is a simpler process usually. So for us in the rostering space, there was less need to redo our processes in HR in my team, but there was a lot of work needed to be done in the business in terms of change. The exact opposite in the payroll scenario. So we did much, much more work, and that's where most of this process work that I talked about earlier, the redesigning and mapping and so forth, that's been massive for the payroll piece. We've virtually tipped the entire process where most of our staff were sitting in a payroll team. We've actually flipped that on its head. So now most of our staff sit in the recruitment and contract management space where we create the contracts and put through the changes, so that the payroll team is really quite skinny. Because of what we consider to be the best approach is that the person who's recruiting and putting the contract together for a new employee has the best idea of the conditions, rather than a payroll person sitting somewhat arbitrarily, down the corridor, just sort of going, oh, well, this is a nurse, therefore they must have X number of weeks of leave. Yes, that's true. But if there are, if it's a one-off, and there's always many exceptions and one-offs, you've probably just put through the wrong arrangements rather than the person who was recruiting and being actually knowledgeable about what conditions that person was entitled to. So we've flipped the process on its head, and all of that change was massive for the team. Yeah.
And a related question there. A related question there would be, and I love that slide of the black belts. It's fantastic. I've got the image of black belt karate people running around the hospitals, which of course maybe not quite. But
No.
How did you prevent people from going back to their old behaviours? Because I think change management, you get the one-off change, but you really have to put in new behaviours that last for a significant period of time.
You do. Yeah, you do. And repetition is key to that, as well as having really clear, obviously really clear instructions, but keeping it, I suppose, keeping the spotlight shone on people in the beginning, in the early stages. So we have, the team has stand-up, in the beginning, when we were putting this through in the early days, they had stand-up meetings, twice a day, I think, where they would actually triage, if you like, the work that was coming through and make sure the team understood what was required of them, and triage problems and issues. And so that continued for weeks and weeks, and then it was, then it was less often and less often, but they still do once a week stand-up meetings, so that there's somebody in there keeping an eye on how they're going in terms of performance. We measure everything we do, so we can see if we're slipping or if work instructions are starting to be ignored. And we have found, my black belt team, my little karate experts tell me that it takes about 6 months for us to be bedded down with a change process so it's completely sustainable. So until you get to that point, that magic point, don't turn your back. Don't think for a moment that it won't slip back. So it is really important to be focused in that time. And different places will take longer or shorter periods, because the degree of repetition makes the difference as to how quickly it sticks. And if you're not doing something very often, it's not going to stick very fast.
And you also made a comment to me earlier that as a management team, you had decided you were going to stick together in a huddle. You had this kind of like a football team image where you were not going to back down, that this was the direction you were going. There was no plan B, right?
Yeah, that's exactly right. Well, it wasn't really a plan B, yes. And yes, we did. I showed you some of the slides. You saw those a few minutes ago, that I took to the executive, and we started to plan a process, and we really, and the Chief Information Officer was the sponsor of the project implementation from the IT perspective, and he and I worked incredibly closely together, and I got the executive around the table, and we said we must do these things if this is going to work. And that involved making decisions around the roster amendment process and how managers needed to work with those processes, and what we were going to do in terms of cascading out, and no workarounds. That is one of the big things for me, is don't replicate your past just because it's easier, because it will be the natural inclination of people to do that. But Mal supported, the Chief Information Officer supported us, and yet Mal stuck, yes, you know Mal, yes, he's stuck with me. We stuck together on this, and we were united in our approach to the quality of the outcome that we wanted, and the processes we knew we needed to get to.
Fantastic. Now, we have a wonderfully long list of lots of questions, and I'm looking at them as you've been speaking. I've been multitasking, believe it or not, and I might ask them in the order that they were received, and so we may sort of duck and weave a little bit from an audience perspective as we think about the story. But let's just go to, we've got a question here. Would Caroline please be able to speak to the lessons learnt in more detail. That's from Jen O'Brien at Epworth Healthcare.
Okay, cool. Probably well, the first thing, and it's slightly chronological, I suppose, in my explanation, is we're so robust in our tendering process. So we were probably way more robust in our tendering process for our payroll system than we were for Kronos, and we were much better with Kronos than we were for an earlier system. By the time we got to the payroll system, we were actually giving vendors a week to demonstrate their wares. So we actually built a little company and gave them that payroll and said, okay, now show us how that would work with your tool, and how you can actually deliver on these scenarios. And one of the really well-known vendors around the country pulled out on, I think, on a Wednesday or a Thursday of that week and said, we can't do it, we can't actually deliver on these things for you. Now, if we hadn't done that, and it had been a somewhat more superficial process, because I tell you what, they were reluctant to pull out, they were not happy, they worked till all hours the night before trying to make their system work to deliver the way we wanted it to, but they couldn't. So that's one. The discipline around the no workarounds is so important. There is always such pressure from the business to deliver what they want, what they're used to, what they'd like, you know, and just be able to tick that box and move on to the next thing. But it's, you know, you don't get what you need for your future if you do that. And workarounds are dangerous, and as is replicating the past. Which we're all comfortable with. And probably the being incredibly joined up and tight from an executive point of view is really important. So you need everybody to keep the faith, and it will be tough. There'll be some tough decisions. There'll be things people don't like, and but it's really important to stay joined up and for everybody to support the initiative, because, you know, there's some pain, cost, distraction, etc., involved in the process. They're probably the key ones, but there are others. I'm happy to to expand further later on if people still want some more.
Okay, great. Let's move on. We have a question here from Susan, who asks, do you roster salaried senior specialists as well as visiting medical officers?
All employed staff, absolutely. Not the visiting medical officers that aren't actually employees. So in our private hospitals, that, if you like, dare I say this, the sort of the true VMO who is not an employee, is not rostered on our systems. Those that are employed but are still described as VMOs who might only be with us for a session, 2 sessions, as well as all our employed senior medical officers, etc. Yes, absolutely.
Is there any other way of getting around, you know, perhaps people who are not rostered in that regard? How do you sort of keep track of them?
Yeah, if you wanted to, you could certainly do it, because we can put volunteers on our rostering system. We can put any number of people on there who aren't receiving a pay. We just don't choose to put our VMOs on there. We haven't found a need to do so, but there would be no reason why I'm sure you couldn't. I'm sure that would be doable. Absolutely, as I say, we put volunteers and others who aren't paid on there.
Chris Spall asks, do you have any plans at all to integrate any of your workforce management systems with any external systems or workforce providers?
We actually do. We're in the process of implementing SuccessFactors. In fact, we've passed phase 1 and we're into phase 2. So SuccessFactors is a cloud-based hosted tool, talent management tool, and that actually does interface with our payroll system, and will ultimately join up with Kronos as well. One of my next phases will be skills-based rostering, and another extension of that, which I won't describe live on air. I haven't actually finished the design of that yet, nor consulting with my colleagues, but there's some exciting developments down that track. And yes, absolutely, the learning development system, the rostering system, the talent management system, and the payroll system will all interface, and some of those are hosted and some of those are internally run.
Gotcha. Okay, Philip Hurley asks, why and how did you select Orion rather than continue with Pay Global?
Orion.
Excuse me, yes.
Yes, that's all right. Pay Global struggled in a number of ways, and I don't wish to denigrate anybody's system, but it struggled in many ways, and it went through a number of changes from a company point of view as well. So from a vendor support point of view, we struggled. The tool itself struggled. It had many limitations, and to be honest, its architecture is not based on the right principles. It's not time-based or date-driven, and for a payroll system, for me, that's not a logical structure. So we really struggled to set it up the way that we wanted it, and that's why we went to market.
Okay. Philip also has a related question on Paid Global. He says, in the old solution Paid Global system, did you have award interpretation rules set up for the manual timesheets that were processed, i.e. 1,600 manual timesheets?
No, the award interpreter sat on Supercard, which was a system that was there when I arrived, and it's just an old sort of unsupported system. So that was separate to Pay Global.
Mm-hmm. Okay, actually Philip is on a roll. He has another one. Have you implemented an automated solution that is scanner devices for staff to record their time and attendance for their rostered shifts?
Are you talking about a card swipe type system? I think that's what he's saying.
I presume so.
Yeah, so that's what I think you said. I won't get you to repeat the question, but I think that's what you said. No, we haven't, but we're going to. And that's part of the plan. That's definitely part of the plan.
Yep. Okay, fantastic.
Sorry, I should say I have done it in the past, so it's not that I haven't done it, we just haven't done it here. So yes, right. I have experience, but we haven't done it here. And it will be one that we need to be sensitive with in health. Indeed.
Okay, actually so many questions.
You're not sure where to go.
No, that's right. The overall process of implementing, this is from, now I'm going to have a struggle with the pronunciation, but the question was the overall process of implementing Kronos TNA. Was it arduous? Were there technical challenges, or just broad indications?
TNA.
Yeah.
Sorry, I just need a translation.
I don't know what TNA.
I don't know what. I'm just trying to think what that might be. Oops. Sorry, I'm not quite sure what TNA is.
No.
Technical and something? No, I don't know. I can't guess. Sorry, it's not an acronym.
Surname. The person who's asked is Harmsworth. If he's here.
Yeah. Okay. Okay.
But
maybe he could just let us know.
That would be good. Let's just see if I can have a look here. Time and attendance, he says.
Oh, time and attendance. Sorry. Yes. Okay. There you go. Sorry, I wasn't thinking that the right way. What was the question again then? So
the overall process of implementing Kronos time and attendance.
Yes.
Was it arduous? Were there technical challenges? Just some broad indications, he says.
Yep. Okay, look, I don't know that we use it to the extent that we could be using it. We certainly have put it in full. I don't think managers are quite as good at using that and scheduler as they could be. I think we've got a little bit of a way to go. So yes, it required lots of hand-holding, if you like, sitting beside the manager in the workplace or the person that was responsible for the rostering in the workplace, and we still support heavily out in the workplace because we want to improve people's skills and the use of the functionality. Was it arduous? I don't know that it was any more arduous than any other system, though, to be honest. I think Kronos is... The way I would describe Kronos, the rostering, is that it is reasonably hard work to get in, but it is so worth it when you get there. And I heard that. I rang around colleagues and rang people who had implemented Kronos, and that was the message that I was given, and that was my experience. It is really worth it. You have a really, really good foundation to work from once you get it in. So, but having said that, it wasn't an awful experience. It was just, you do need to put the time in.
A question here from Sharon. Sharon Seymour asks, was there much resistance from clinical managers as this change process unfolded?
Actually, not as much as I would have thought, to be honest. There was a little reluctance to tear down the spreadsheet from the wall and to do your scheduling in the system. And I have to say there's probably a few pockets where people perhaps aren't doing quite that. And there's still the odd one who's typing their spreadsheet into the scheduler. No, We took them on, as I said, it happened across the organisation. So we didn't just, it wasn't big bang. We didn't just all do it in over a month or 2 months or even 6 months. It took more than a year to roll it out across the entire organisation, and it was horses for courses. So those who came from a manual arrangement where they had never had an automated rostering system took a slightly different journey than those that had already used an automated system, but one that perhaps wasn't working very well. So.
Yeah, so you were spending a lot of time making sure that people were journeying with you, and
Correct.
if not, you had black belts.
Absolutely.
If not, you had black belts after them anyway.
No, my black belts actually stay behind up here in making sure that the processes that lead into the systems are working really well. Yeah. They don't go and karate people out in the hospital if they're not doing what they're told. No.
We can but hope for the future. Now, Jenny O'Brien asks, what was the makeup and EFT of the project team for each project?
Oh, okay. Now I'd have to go and check on that, Jenny. Look, I'm guessing this is probably a terrible thing to do. It was probably slightly larger for the payroll project, I think, than the rostering project, because, as I said, we took a smaller part of the business at a time in the rostering project. The rostering team was here for a while because obviously it took us longer to get right across the organisation. I'd have to check, but it's for the rostering. I'm guessing it was less than 20. It probably was considerably less than that, but just to give you some sense of scale, it's not hundreds of people or 50 people or anything like that. For the payroll project, at a point, it may have got to as many as 40, but that was at a particular point, and that's probably where we were doing lots of script testing and data cleansing and all sorts of quite manual stuff as well, so just to get ready at particular points in time.
Where did those people come from?
Yes, now that's the interesting piece. In the rostering setup, we seconded some people for the whole project from our rostering team, and then there were some external consultants who came in, and the project was led by an external consultant. Quite differently in the payroll project, we started with external consultants leading the project, and in the end we opted out of that arrangement, and we selected somebody with project experience, knowledge of our payroll environment, who had been a consultant in a previous life, and provided support to her to step into the role, and she excelled. And so she had that in-house knowledge of our operating environment, I suppose, and our vision. And the team would go across from the payroll and HR environment on a regular basis, so they didn't just move across wholly and solely, all of them. Some of them would go backwards and forwards. Some were seconded for the entire duration, and some were external. A couple came from the Queensland Health payroll team, which was interesting. Payroll project, and brought some lessons with them.
Indeed. Okay. The next question I'll ask is from Stephen Anning, who says, which systems perform the award interpretation, Kronos or Orion?
Kronos. The rostering system. Yeah.
Yeah, that's right. And that's working well?
Yeah, absolutely. Yeah. Oh, look, it's fantastic to have a robust, healthy, well-run, well-supported award interpreter, because that's critical, as most of you will know.
Yes, indeed. Okay, great. And still so many questions coming in. It's fantastic. Now let's see here. We have a question from Jane Stewart. Has ESS/MSS played a role in the success?
Yes. I think the employee self-service in the payroll system particularly has been successful. And it's interesting, I was told that everybody would have to be trained, we'd have to have people in classrooms learning how to use employee self-service, but we took a really light touch in the end. Taking 7,000 people into classrooms to train them is enormously costly, and diverts people's attention from the business that they're running. And so we made little clips, video clips, 3-minute video clips and so forth, and showed people how to work their way through the ESS, and people love it. It's certainly contributed to the reduced number of phone calls that we get. And for me, it was actually critical on Go Live Day to people being able to see their payroll, see their bank details, see what had actually been paid into their in through the payroll, and all the detail that's sat behind that, and then being able to manage their own information on the system. It gave people confidence in the system, and that accessibility and usability was really important.
And reduced the number of phone calls you would have received, I presume, too.
Absolutely, absolutely, and continues to do so. Yeah,
yes,
yeah, absolutely.
Exactly yeah. Okay.
And we have self-service for rostering, but we don't. Sorry, but I was just going to say we have self-service for rostering, but at the moment that's only being used in the administration, amongst some administration and clerical staff, and we will be rolling that out further.
Fantastic. Philip Hurley asks again, when the interface occurs between Kronos and Orion for the payroll to occur, how much effort is required to validate and check the data by the payroll team, if at all? Great question.
The technical, yeah, that's a bit technical for me, but I can tell you this. I know that in the weeks when we were running Parallel before we went live, I was standing in the corridors as you do when you're working very closely, but nervously watching what everybody's doing. I'm very conscious that I was aware of every single step of the process, and there is definitely some checking. It's not just a direct upload that I'm aware of, or it certainly wasn't in the beginning. And even if it is completely automated, there's absolutely reporting that we get, so both by exception and otherwise, that goes on to check what is actually transferred from the rostering system into the payroll system.
And you actually don't have that many people on team that need to sort of do this anymore, do you? You were talking earlier about that.
No.
How many people is that again?
Well, we went from, when I started, there was about between 12 and 17 in payroll. It seemed to vary for some reason. There were lots of vacancies. And then we had to up it to 22 when the system started crashing so regularly. We were doing so much manual work. We're down to 4 people processing pays now, with a payroll manager and 2 seniors who are responsible for quality and compliance and auditing. So, yeah, very skinny.
4 people
very
for
skinny.
How many staff?
Yeah. About 7,500. We do have, I should be clear though, there is a small HRIS team, and there's also some people who support the rostering function. So they both are in the business, helping to manage enhancements and bring people on the journey, but also systems administrators. So they perform both of those roles. So the payroll team who do the processing obviously don't perform any systems administration roles. But yeah, to go from 22 to 4.
Yeah, that's amazing. my maths isn't great at the best of times, but that's about 1 payroll person per what, a bit north of 1,000 people.
About 15. It's about 15. Yeah, it's about 1,500, 13 to 1,500. Yeah, if you add the seniors in who don't do any actual processing, it's about 1 to 1,100, 1,200. That's right. And as I said, we did direct some of that resource that I saved back up the chain in the process to make sure we got really high quality data being entered from recruitment and contract management, but not all of them by any means, 1 or 2.
Okay. Now this is an interesting question. This is from Philip again. How does time and attendance get recorded by staff? Directly via the PC and the Kronos system? Staff
at the moment
directly, and how is that managed?
Oh, that's a little bit more detail than I've probably got, but yes, and yes, I think is the answer. We're going to be moving to some form of automated, so it'll be a card or a retina or some, you're using your iPhone to record attendance. But at the moment, people go into the system, and nurse unit managers and their clerical staff basically run that process. But I'm happy to have a conversation about that offline when I've got a bit more detail, because I must admit it varies across the organisation, and I'd probably have to go.
And is it the sort of thing where you would actually ask staff what would be the easiest way for you to do that? I mean, for example, a swipe card, I imagine, might be.
Yeah. Well, people wear swipe cards anyway, because we need to be able to, on a hospital site, be able to get in and out of places that are with restricted access and so forth. So they've actually got those on their person, so they are really easy. Yeah, look, we might ask, but we probably want to consider all the different reasons why a particular methodology would be the best. And it'll go to, obviously, convenience as well as cost, as well as effectiveness and suitability for to meet the needs of the people in that particular area.
Another great question from Susan Cicchino. Excuse me if I got your name wrong. You mentioned that you have a single source of truth for staff, so I'm assuming that you have control from HR Kronos and push to payroll. Is that the case?
Yes, Susan, that is absolutely the case. Yes, definitely. So they all sit in my team, both all the people that run all of those different tools, and yes, one does push to the other, or one pulls the other. Yep.
And I imagine that was quite a confronting journey too, by the way, for people to be able to say, I can trust this as the single source of truth, because I know in IT that's, quite a hallowed goal.
Yes, absolutely. Yes, look, you're right. And, one of the areas we noticed that the benefit was in the directory system for staff information, so the telephone directory system. We were immediately able to update and upload information from the payroll system into that to make sure it was correct. It wasn't having to be updated separately. So really simple, but just frustrating things that would in the past drive you nuts when you're looking up somebody's details and their title's wrong, or where they are located is wrong. Now it's just, it gets pulled out of the system or pushed out of the payroll system, and it's correct all the time.
That's great. We've been making great progress through these questions, and I've been able to sort of sort them and organise them at my end. Just to let you know, we have two more, unless anyone wants to add to my list. One here from Stephen Dobson, which just goes back to that previous conversation about the payroll staff. What resources do you include in your current resource ratio assessment of 1 to 1,500?
Oh, okay. The one for payroll staff, so that's people actually processing. As I said before, so there's 4 of those now, and there's about another 3, which would include the manager and 2 team leaders who do audit, quality, compliance, and those sorts of tasks. So they're not actually processing pays, and the employee ratio element is a head count, so it's not an FTE. So because in health, 85% of people work part-time, a person's a person as opposed to an FTE, which might actually be made up of 3 people. And obviously from an HR point of view, we treat people as individuals. So it counts heads in health. It's pretty important. Yes. So I think that explains that ratio. There are, as I said before, there are some systems administrators and others who sit in the HRA's team, which is located as part of my division, who manage changes to the systems and controls and things like that, but they don't process anything.
Excellent. Stephen, I hope that answered your question. And we have another question here. This is Senrad Harmsworth. Does your ESS provide leave application, and how does that hit your rosters?
Yes, it does, and I don't. Technically, I couldn't tell you how it hits the rosters. I'm terribly sorry, but yes, it does. Our leave requests are automated now, so I know. I mean, as a manager myself, people will send me requests for leave, and I can process them on the system, and then the system drags them in some way, shape, or form into the rostering or scheduling functionality. But look, I couldn't tell you what happens inside that black box to make that happen. Sorry, somebody was.
The point is, you can trust it to do the right things.
Absolutely, absolutely. Yeah, definitely. Okay. And of course, as you might remember, I mentioned earlier that previously we had the award interpreter actually corrupting, I think it was leave and various other data sets, which was a nightmare for us. So now we are really robust in our leave space and those around data sets. Yeah.
Now, it is, by my clock, 12:23. We have gone past the 12:15 as I had suspected, which is great. Let me just ask you a few closing questions, and which will probably take us to 12:30. Sure. We have actually got through all of the audience questions, which is fantastic.
Oh, well done.
Yes.
Well done.
You've done very well answering the questions, Caroline, so thank you for that.
It was the management of them.
There you go. What were the top 3 things you learnt from this transformation process?
That it's more, that anything like this is really much more than just implementing an IT system. That it's all the processes and the behaviour and the cultural elements that influence that piece of IT that will make the difference to whether or not you're successful. That's probably the biggest takeaway for me. And don't be afraid, because I must admit I'm a bit focused on outcomes and achievements and timeframes and obviously budget and so forth, but and there is a balance and one has to keep pushing forward, but at the same time don't be afraid to slow it down by a month or 2 months if you have to, because it's really important to stay true to your plan and make sure that you actually are ticking off all those risks and managing all those risks, because we've got examples of people who haven't done that and have just been wanting to tick the boxes and move on, and you either get a workaround or you get a disaster. And even with your workarounds, you potentially get disaster. So that's probably number 2. And then the third one is very much about make sure that you stay true to what it is that you actually want to get out of your system. So don't just treat it as a project that can get ticked off. Make sure you're changing behaviour. Make sure you're building the system you actually want to live with and the configuration that you actually want, not the one that is just the easiest to do at the time, because it gets hard, because it is a long slog, but if you want the outcomes that you've obviously purchased the tool for and you've started this journey for, yeah, stay true to it.
That sounds to me like you don't compromise.
Not much. You do have to sometimes, and I have to say the team have persuaded me to compromise sometimes, but we've had to think very carefully about it. You don't do it flippantly.
Yes,
yeah.
Indeed. What new opportunities has this new system given the Marta? What are you thinking about for the future? And there was one question earlier about this too.
Yeah. Look, there's so much that we can do that will take us to a place where we can actually make sure that the quality of our patient outcomes is improved by having the very best, most skilled, most experienced clinician by their bed, or by having the person with the best skills in a particular department at the right time. So it will go to supporting our long-term strategic workforce plans. It allows us to look at not just skills but levels of experience. It allows us to, and we'll need to do this in the next few years, because as our workforce starts to become workforce shortages start to become critical again, we're going to find ourselves having to compete for staff again in a way that we haven't had to the last couple of years. And so workforce flexibility is going to be really important, and empowering employees to have the flexibility that they want to make themselves available when they want, and for us to be...
Are you there? Are you there, Caroline?
I am indeed. Did you lose me for a second?
I lost you for a moment. Could you just repeat that last bit, please?
Which bit? So was that the bit about the workforce flexibility?
Yes, that's right. So, and I think that's an important thing for the future of workforce management, isn't it?
Absolutely. Well, because as we get out of this post-GFC effect and we start to get back into a place where staff, we start to have critical staff numbers, and we know that's going to happen, it is really important that we build workplaces that allow staff to work when and how they want. And, I still think we've got a long way to go. Some organisations, some health organisations are better at that than others. We're probably not as good as we could be, and there's lots of room for us to put tools in place that make that really easy for a clinician who's working potentially part-time or who wants to be flexible in the way they do their work and how they make themselves available. And there's lots and lots of functionality that these tools have, and I think we'll keep producing, and we really need to keep making the most of those.
Yeah, absolutely. Very last question, just and answer this briefly if you can. Given where you were before with all the different systems and the pain that you were experiencing in the organisation, how do you feel now? Yeah, no, how does it feel?
Oh, look, it feels good, because it just feels like now, now we're not worrying. There's no noise. I mean, the noise was amazing, both at all levels of the organisation. So there was a fear of meeting a colleague or going to a meeting because you were going to get attacked by the desperate situation that people were in. And I mean, I understand that, because they were feeling the pain, with people's pay being wrong all the time and so forth, or shortages of staff, or not having the visibility that they needed, or whatever. So it feels really good now, because now we can look forward. We can really say, what do we want to do? what good things can we do for this place, what's possible.
Yeah.
And when we come up with plans, we can say, oh, how would the system help us do this, or what could we do with it to enhance that, and it's just great. And all the systems can now talk to each other. And then we've got this fabulous ability to push and pull information in ways that's really cool, and helps make really good business decisions. Yeah.
It's a great story. Caroline Hudson, on behalf of all the attendees, many of whom are still with us, thank you very much for your time and all of the effort that you put into preparing your presentation for today. I really enjoyed your presentation and the detail at which you answered the questions. Thank you to all of our attendees who have joined us today. This has been a live healthcare case study on Mater Health Services, an ehealthspace.org webinar, proudly sponsored by Kronos. Thank you to Kronos for making this happen. And can I just say to everybody, we do value your input and your feedback. If you go to ehealthspace.org later this afternoon, I will be working feverishly away on a story which summarises the conversation we've had. We have been recording this as a video webinar which we will play, and you'll be able to access that again, to watch it again on ehealthspace.org, to watch that again and maybe review some of the comments. So again, thank you very much, and until next time, and thank you again, Caroline.
Thank you. Thank you, Mark. Thank you, everyone. And I hope, yes, you got the information that you were looking for today, and I'm always happy to share and have a conversation.